play.
All right, this is our Ignite presentation over Achilles tendon ruptures, also known as ATR for short. I'm Matthew McClure, and this is my partner Michael Kurtz. We'll be talking about the rupture itself, ways to heal, and a new service that helps it.
So this is the Achilles tendon. It attaches to the posterior calf muscles, the gastrocnemius and soleus, to the heel of the foot. As you can see from the diagram, it goes down the backside of the leg.
Achilles tendon rupture is basically when that tendon that connects the heel to the calf muscles tears. It can be a partial tear or a full tear. Pain kind of differs between the people, and yeah.
This is the prevalence. As you can see, it's mainly males due to this chart on the left, mainly between the ranges of 20 to 40, and it's mainly in basketball that these injuries are seen.
Some symptoms of ATR. The main symptom is like a burning sensation around the area that can be felt in the heel or the calf muscles. Swelling will occur, just depends on how bad the tear is.
Causes of ATR is stretched beyond the limit, or mismanagement or lack of awareness of the previous injury, forceful movements, and lack of conditioning of the tendon. So it'll just snap due to it not being used to the stresses that are currently put on it.
Some tests for ATR is a physical exam, which is the main one. It usually can be told if it's torn right away, but if not, there's MRIs and ultrasound. And this is a picture of a partial tear on an ultrasound while the foot is in dorsiflexion.
Some treatments are surgical and non-surgical. Most treatments are surgical. Non-surgical is mainly for elderly population who it's dangerous for them to go into surgery to repair it.
Mm-hmm. Surgery for ATR, it basically is just an incision in the back of the calf, and they take the two ends of the torn tendon and they just stitch them back together. And with time, the tendon is able to fully heal itself if the right precautions are taken.
You can use RICEs to heal it. So rest, ice, compression, elevation, stabilization, just like most common injuries. You just take those steps and inflammation will go down if it's inflamed beforehand.
A walking boot is another good thing to use for an Achilles tendon rupture. This is used for both surgical and non-surgical. And going back to RICEs, this helps the stabilization part, and it keeps weight off the tendon and allows the foot to not go in dorsiflexion or plantar flexion.
Cryotherapy, or using ice, which is part of RICE, it used to make the time frame of healing lessen, and it helps with swelling and pain. It vasoconstricts the blood vessels.
Thermotherapy is the opposite of cryotherapy. It's heat therapy, and this is usually used in the latter part of the treatment, and it's going to decrease the stiffness and the pain within the joint. It allows for more blood circulation, and the range of motion can also increase when this is used.
Hydrotherapy can be used to help relax the muscle and begin load bearing back onto the surgically healed tendon. So that helps a lot with it.
E-stim, which is also known as electrotherapy stimulation. This can help with re-educating the muscle fibers. The NMES unit specifically helps with contractions, and all the other ones kind of just send electrical things through the muscle fibers.
Massage therapy can also help to relax potential muscle spasms, improve blood circulation, decrease stiffness and everything. And it also helps improve range of motion. So the tendon can now move functionally.
Functional rehabilitation is similar to physical therapy, but this is actual exercises that the specific person can apply to their daily life. So it can be used as like motivation for whatever the person is, whether they're an athlete or whatnot.
So this is the limited incision knotless technique. It just uses a 2 centimeter incision, and it uses locks to attach to the bone and decreases sutures.
Advancements for this is it actually decreases the likelihood of an infection, which is high with other surgeries. And the sutures can't rupture because there's no sutures really. And downfall is it's more expensive.
So recovery time with this type of surgery is increased. 80% of the people who use the surgery return to a pre-injury activity level, so they're back to full strength and playing. And there's also a lowered rate of re-injury and infection. As you can see, we put Kobe because he obviously came back from Achilles tear and was very successful.
Mm-hmm.